You're watching Beyond Markets. Welcome, I'm Esther Awuni. Many thanks for joining us. On today's show, we'll explore ways to improve Africa's health outcomes with innovative solutions. You can join today's conversation with the hashtag Beyond Markets, and you can follow my Twitter handle too, at Esther O. Awuni. Now, according to Talamus Health, for decades, the healthcare challenge in Africa and other emerging markets has been dominated by the fight against communicable diseases. However, the underlying this threat has been the growing prominence of chronic illnesses and the lack of capacity to provide the care needed to address them. Dr. Murisiku Rafiu, founder of Talamus Health, joins me to discuss ways to improve Africa's health outcomes with innovative solutions. Thank you so much for being here today. We appreciate your time.
Thanks for having me.
Before we look at how technology is disrupting this space, especially how Talamus is disrupting this space, let's talk. I'd like you to just look across the Africa's healthcare system, the value chain, and those challenges that you see that continue to pose to hold us back, as it were.
Well, I think if you look at across the board, especially with African countries, the healthcare expenditure as a percentage of GDP has been woefully low for a while. There was obviously the Abuja Declaration, which is meant to really set a benchmark for what people should be spending, what countries should be spending, and most countries have not been able to meet that, not even close. So what is happening is, on the one hand, the government expenditure is low. The majority of Africans still get their healthcare through the public sector. In the private sector, the size and the competition and the number of hospitals available are simply not there. And then you couple that with the challenge of the brain drain that we've always known about, which continues unabated. Then you have a serious combination that is really putting the risk of people here. And then the other issue, as you mentioned earlier, has to do with this sort of transition from the dominance of communicable diseases to now the prominence of all these other sort of more chronic diseases. I mean, I'm sure you've had this experience where someone will call you and say a friend you knew who was only 42 years old dropped dead overnight. And you wonder what the hell happened. This guy just seemed kind of healthy yesterday and all of that. So our understanding and our attention to treating some of these underlying issues that can be silent killers has also been inadequate. So there's really a need for the rethinking of what is happening in terms of disease burden on the one hand, and also how can we now start looking for ways to create facilities to train more people to be able to take care of Africans in general. Okay. And this is important for the economy. You need healthy populations to grow your economy. It's just as simple as that.
Before we go into technology, let me just quickly ask you this. Would you say that, because I know that for African governments, looking at their yearly budgets, I mean, there's so many competing needs, so many sectors, so many things, especially infrastructure. Yeah. But would you say that when it comes to allocating funds to sectors like education, health, do you think that there's still a priority issue? Or because perhaps maybe the returns are not tangible, one cannot see, like when you spend on infrastructure, you spend to build the road, you see the road, you spend to build.
It's a complicated thing, right? On the one hand, obviously, the facilities that exist, there is some inefficiency in the way they actually function. So there's a need to even rehabilitate those to start to squeeze as much value out of them as possible. There's no question that there are new things that need to be built, but they need to be built smart. And what is happening is that you get these white elephants sometimes of things that are built that actually don't function. Healthcare is a complicated, it's unlike road where you build it, people get on it, maybe potholes start showing up and people complain. But healthcare is beyond just building a shiny hospital. It's the culture of care. You have to have people who are adequately trained to take care of it. For example, you're in a hospital. You can get nosocomial infections that spread quickly and cause a major havoc simply by not having a janitor who cleans the things appropriately. So every aspect along the value chain, healthcare needs to work well in order for people to get care. If you're giving people expired medications, even if they get the right diagnosis for it, they're not going to get well. So it's one of those environments where it's a circular environment where all the different players really have to be doing well. So the way that these are dealt with need to be really comprehensive and broad. And definitely we're not, you go to most countries, in America, the GDP, healthcare expenditure as a percentage of GDP is about 17% and growing. And so, you can't spend 5 when you look at Ghana and other countries, they're spending, around 5% on healthcare, which is not adequate at all.
Now, experts tell us that despite the fact that Africa has very weak healthcare systems, technology can help us leapfrog across the value chain. And we are seeing that happening already. Talamus Health is also, you're also a major player in the space causing those disruptions. But tell us, looking across the value chain, how technology can help us to begin to leapfrog that and also what we're already seeing.
Well, I think there are two aspects to this. And I don't want to give the concept misperception that technology is the solution to this healthcare issue. It's a very important and I think timely component of solving a much more complex problem. I think we do need more hospitals. We do need more people trained. We do need a better culture of care in general. Those are all very important. But I think technology gives us an opportunity to really rethink some of the paradigm of how people access health. It's not just about digitizing healthcare, and I think this is a very important point. It's about saying if you digitize an existing problem, you're not solving anything, right? You have to digitize in a way that solves that problem. There are some solutions that have come into the market that basically said, well, you can put your records here and here and here and here. That doesn't do anything for anybody. How does the patient now relate to that record? Are you making the patient's life better beyond the interaction with the doctor? You have to go beyond just the traditional way of doing things, because one thing we know is that the traditional way is not doing the job. So we have to bring in new concepts that's going to allow us then to actually truly leapfrog.
Now, some people might wonder, okay, we're talking about bringing in technology. You said it's not just to, it must also solve problems, obviously. But there's also the issue of cost. Some might wonder, we're bringing in technology, that automatically could mean higher costs. How can we integrate technology in a manner that's still cost-effective overall?
So when you talk about technology in health, it's not just digitization, right? You have to think about actually equipments and things like that, right? So there are two sides of it. I think digitization really done well has an opportunity to bring in efficiencies. That kind of creates more value than anything else. The equipment side of things has the ability, obviously, to allow earlier diagnosis. If someone is getting the mammogram, on the prescribed intervals, then you detect it early. The cost of actually taking care of that person is less overall than if the patient comes in and now they have stage 4 breast CA as opposed to a stage 1 when just a lumpectomy may be enough. Then at stage 4, you're talking a lumpectomy, probably complete resection, followed by chemotherapy, followed by radiation therapy, and all those things now becomes a cost burden, not only for the system, but also for the patients. So those are the two things. One, you need some of these basic equipments to be in, but the technology can actually make them work better and create a way that makes the patient a little more empowered to take control of their lives.
So what would you say, how would you assess the rate of adoption that we're seeing on the continent as far as technology is concerned in helping to strengthen the healthcare system? I
think that there is, obviously with anything, there are the early adopters, and then the middle folks who all follow the crowd, and then the late adopters. And we have found that there are some doctors, even here in Lagos, we have found many doctors who are very excited about technology and what it can do. But there are some places that don't feel like they're ready. Now, even if the doctor is interested, maybe, well, we don't think our staff is ready. So there are all of these things that, the job is on us, those who are providing it, to actually let people see the value in it. When you create a platform like ours, what you have to do is you have to provide a reason for somebody to use it. If it's the pharmacy, they need to know that this makes my business better. The clinic needs to know that this makes their clinic better. The lab needs to know that. So you have to create something that gives everybody something. and in the process created in a way that benefits the patient ultimately. And I think that's sort of the kind of thinking we have to get in is that when you have a segmented market like this, where people are used to having complete control within their space, to get them to be collaborative, you have to give them a reason to do it. So you have to think about it on a broader sense than saying, okay, I'm going to provide a solution for these people. I'm going to provide a solution for these people. And some of the technology that's been coming into the market is doing just that. It's very segmented. We're saying a more holistic approach actually is called for us to have the kind of impact we think will transform healthcare on the continent.
Speaking about transformation, let's talk specifically about Talamus Health, how you are also helping to transform the sector. I know that you have this platform. Talk to us about that.
So basically, I'm a physician myself, and I've had family members who have been sick here on the continent, and I saw firsthand the challenges that they faced, and also as a family member trying to get information, how difficult it was. And I remember saying to myself, well, there's got to be a way for not only the patient to be empowered and for them to have the right kind of information to make decisions, but there's got to be a way to make the job of those taking care of the patient also easier. See, it's not a dichotomy. I don't see it as sort of this versus that, but rather this and that. So we said, okay, who is the primary client here? And that's the patient. So let's start with the patient. What do all these other people who the patient is going to interact with, what do they need to do their jobs better? And we went to start to solve those issues for them. So for the doctor, what does the doctor's clinic needs to run better so the patient has a better experience there? We built that. What does the pharmacy need to do to make it easier for patients to get their medication when they need it? Went to build that.
Okay, so all on this one,
exactly.
All on this one platform.
Yes. So that's how we went about it. We asked, okay, who are the people the patient has to deal with on this journey, or from getting sick to getting better, and how do we make those people's jobs easier in a way that benefits the patient? So what we built then was to build solutions on the same platform for all these different players, designed to make their job easier. And in the process, what you find is that the patient's interactions is more efficient, there's more transparency, there's more information, and patient has a much better experience. Okay,
I mean, for those who are just wondering how this works, I need you to just paint a brief scenario how this works from point A to the end.
Exactly. So imagine I'm a patient.
Okay.
I'm sick. I need to find a doctor. I can go on Talamus, find a doctor by location, by name, by specialty.
Okay.
And I can find out if they have time slot available and make an appointment right from my phone.
Is this where geographical location? Where,
yes, you can do it by geographic location, by specialty, by name. And you make an appointment, and 24 hours before that, you get a SMS reminder reminding you of the appointment. If something's changed, you can change the appointment right from your phone to another one. Now, when the appointment's been scheduled, so when you go in, it's pending. When the doctor reviews it, you can even leave a note for the doctor. The doctor or clinic can review it and say, okay, it's okay to come in. That is scheduled. Okay. If things are changed, you change it. And then that slide becomes available for another patient to use right on the spot.
Take a quick break. I'll be right back, speaking from where we left off. I've been speaking to Dr. Murisiku Rafiu, founder Talamus Health, looking at how technology is disrupting the healthcare space here in Africa. We'll continue our discussion right after this break. To join us again. Welcome back to Beyond Markets. If you're just joining us, Dr. Murisiku Rafiu, founder Talamus Health, is with me today, and we're discussing ways to improve Africa's health outcomes with innovative solutions. Thank you for your time so far. You were talking about, how this amazing process of, patients getting access to the doctors, without, just taking out all the former cumbersome methods. Now, for you, now with this platform, what is the next step? Or first of all, before I go there, talk to me about the feedback mechanism, how those who are experiencing this, what their stories are, and how this has become life-changing for them.
Well, I think this is great because our approach has really been to go to the neighborhoods. We think that there's a way to democratize this process so that this is not the domain of those who can really afford it. Right?
I was going to talk about affordability.
An app like this for the patient is free. They don't have to pay to download it. We think that the value added is for the clinics to have more traffic and better patient experience. So as I was saying before, the doctor can then, after the video, even order medication to a pharmacy in your neighborhood, or you can forward the medication to a pharmacy in your neighborhood, and if they don't have it, they can actually let you know it's out of stock. So instead of now going from pharmacy to pharmacy to pharmacy, looking for that particular medication, you can actually, from the comfort of your phone, forward it, get feedback, forward it until you find the one that has it, and get directions, Google Map directions right from your app to go and pick it up. So this has sort of thoughts. This is just one scenario. There are many scenarios on this platform that we've created. You can even pay by mobile money your clinic. So this is really a fully integrated experience in the sense that we think people should be able to then coordinate. And beyond that, you can even coordinate to have several of your doctors communicate with each other.
No, well, sorry, speaking about doctors, because I'm thinking, how wide is this network in terms of the number of doctors, and the pharmacists, the laboratories?
Yeah, so some markets are a little more robust in terms of, mostly because of the time spent so far. We have, in South Africa, about 650 pharmacy outlets and about 300 lab outlets in South Africa alone. Okay. And we are connected to about 97% of the insurance companies electronically. In Ghana, we have about 25 clinics, about 30 pharmacies, I think. I hope I'm not having the wrong number. And I think, 30 labs and about 40 pharmacies. Okay. In Nigeria, we have about 40 pharmacies, maybe 30-something labs, and we have about 65 clinics / hospitals. Okay. And this is growing fast. I mean,
because I was going to say, for a product like this, for an innovative product like this, scalability is very important. And I know that key to that will also be funding.
Yes.
Talk to us about that. I mean,
so we're currently going through a funding stage. We have already proven the concept. We've proven that we can actually get all the different players onto the platform by creating the ecosystem. And we've been able to do that and get a lot of positive feedback. The technology is scalable. As you all know, we won the award as the most scalable SME for 2018. So we already had the technology part of this figured out. We spent the last year in those 3 markets figuring out also the sort of soft side of things, the marketing side, getting some key players on board. Now that we have it, it's time for us to really go broad and fast.
When you talk about key players, my mind goes to the government.
So we do have a couple of governments that are interested. I can't quite divulge quite yet.
Okay, that's fine.
But one major government in West Africa is interested in working with us, and we've been actually doing some pilots with them at the moment. I think, healthcare in Africa, you can't go big without involving government. Mostly because the majority of people get their care at some point in their lifetime through the public domain. And because people just can't afford to pay out of pocket in the private sector. It's just the bottom line. The majority of Africans can't. So the kind of impact that we're looking for, and that is really transformation of the patient experience on the continent, we need collaboration with the governments.
So all this can only be done on the mobile phone?
We have a limited desk, but we are really going a mobile first, mostly because the trend everywhere is mobile. Even if you go look at it.
Sorry, but I asked that question because I'm thinking about the rural areas. I mean, really those who are really at the bottom of the pyramid.
Yes.
I know that Africa has a huge, when it comes to the mobile penetration, mobile phone usage, the numbers are huge on the surface, but there's so many parts of the continent where in the rural areas people simply do not have mobile phones. There's no broadband penetration there. So
absolutely. So we had this in mind when we started doing this. So we built it to be one of those things that really allows for very low bandwidth usage. Okay. So we really started off with that. We were Africa focused. We really thought about a lot of these things. Secondly, a lot of the notifications that are built in are also SMS based. So even if someone cannot do all the other stuff on the phone, they get the information they need when they need it, so they can take action. One of the other creative ways, obviously, is that if someone doesn't have a smartphone or access to data, there are ways to really create these communities where a designated person can be sort of the point of contact for them to actually go and get the care that they need. Okay. So there are creative ways to do it. I always say that you have to respect your clients, and in this case, the patient's willingness to learn and fight to alleviate their pain. So their pain point. And if you don't do that, you're always going to create mediocre solutions for them. And for us, we are building this thing, one, preparing this platform for the future, but acknowledging that there are some gaps that need to be dealt with in the interim. But we don't want to dilute the kind of solution we create for people just because of this whole thing about well, there's not enough broadband. Well, there are ways around that.
So, but what is this going to evolve into in the future? Let's hypothetically speaking, you get the required amount of funding. What kind of scale, what kind of size, and what kind of, how would you think the disruption itself could evolve within the healthcare space?
We want to blanket the continent to start with, but we also are looking at other parts of the world. The app is available in French and in Portuguese. If your phone, your default language on your phone is French, you're going to see the app in French and be able to interact. There are many other things that is not on the platform yet that are in the works.
Are you looking at it? Because I'm thinking about, for many of these rural areas, many of them do not speak the key languages like English, French, Portuguese.
You just read my
several
thoughts.
Dialects, even in Nigeria alone.
You just read my thoughts. And definitely we are moving in that direction. But we're doing it in a way that will surprise you. And I don't know if I can quite say it quite yet. But let's just say that we are looking, quote unquote, at the anthropological aspect of health, which almost very few people ever talk about. Healthcare is not just about the disease process; it's about psychological process, about cultural, aspect of it. And I think it's time healthcare on the continent start to look at that and kind of incorporate some of these issues that actually affects how people access health, how people think about disease, and how people think about life. Into the care process. So we have a lot of these things that we are thinking and working on quietly.
Do you think that, a difficult part of the process could be, because you're not just selling a solution, you're also having to convince people that they need some of these solutions that you're providing to them? Yeah,
like I said, this is all about looking for the early adopters and kind of creating a community and kind of showing the concept that this actually works and that it's to your benefit to be part of this process. Ultimately, we obviously see ourselves as a marketplace. And I think what is good about marketplaces is that it provides the client with a lot of options. And for them to make decisions, pricing-wise, all sorts of things, location, pricing, all those things. When you have all of that at your fingertips, then you can make a decision. A small example is if you go to make an appointment with a particular doctor at the clinic, you actually can see what the consult fee is. Okay. You can see what insurance companies they take if you have insurance. You can see all that information right before you even look at the available dates and time slots. So you are making a decision already there that, this is something I'm willing to do. And if you have even questions, there's a phone number there. You just tap on it, it calls a place for you. You can ask all the questions you need. So the idea is when you're sitting down on your phone, you should be able to look at all these things and make an educated decision because there's a lot of asymmetric information at the moment where patients simply don't know until they show up at the spot. So we're trying to create a little more transparency so patients can actually make those kinds of decisions. We think long-term that's good for the patients.
Okay, I was particularly about the insurance arm. Was that a whole different thing you had to work out separately and then integrate into the platform? Well,
the insurance market obviously is evolving. I think of the three markets we're in, South Africa is the most mature insurance market. But Ghana and Nigeria are also building up. And people, it's a two-sided thing. The population needs to understand this concept of pooled risks, right? And that is, I pay insurance, I may never use it for the year, but it's okay because if I ever get a catastrophic situation, somebody else who paid that year is actually helping to take care of me. And I think that there's that cultural aspect of it that needs to change. And then the insurance companies also have to start looking at capitalization. There needs to be more regulation so that there will be a reinforcement that if I'm sick, actually I'm going to get the care I need. As opposed to if I'm sick, I'm paying, but when I get sick, I'm not getting the care I need. It kind of creates a deficit of trust. And that then is going to hinder the ability of insurance companies to go big. From our end, as a marketplace, we think there's an opportunity for insurance companies to make their services available to people so people can shop and kind of make decisions as to what insurance companies to do it, but also for the clinics and hospitals to know that they will be paid on time. So there's all these aspects of how an insurance system should work, and we are hoping to be a sort of a umpire,
as it were,
if you will,
okay.
in that process as well.
Dr. Murray, thank you so much for talking to us today. We appreciate it, and it's a phenomenal solution that you're providing here. And of course, we'll keep an eye on this. And perhaps when you get that funding, you can come back and tell us all about how the next phase. Thank you so much for talking to us today. I've been speaking to Dr. Murisiku Rafiu. He's a founder of Talamus Health, and we'll be looking at how technology is disrupting the healthcare space here in Africa. That's it on Beyond Markets. Thank you so much for being a part of it. Remember, you can watch the show at 5 p.m. West African time daily and have access to all previous episodes of Beyond Markets on our website. That's cnbcafrica.com. You can also send tweets to my Twitter handle too, at Esther O. Awuni. Thank you so much for watching, and bye for now.